With me now is Tessa Johnson, president of the North Dakota Nurses Association. She is a registered nurse and executive director of a long-term care facility in Dickinson, North Dakota. Tessa, thank you very much for being here. There was a governor's order that said that asymptomatic nurses and hospital staff, health workers, should go to work even if they test positive, as long as they're asymptomatic. That's caused a bit of a stir in North Dakota. You're one of the people who is unhappy about it. Tell us why.
Yeah, absolutely. When that order came out, I think the most frustrating thing right out of the gate was that we felt as nurses in our state that we were not consulted when making that decision. And so as such a large stakeholder in this situation, we really felt like the nurses should have been at the table when making a decision to that degree. Nurses really have been putting in numerous hours, extra shifts, extra days to care for our patients since March. And that means less time with our families, less concentration on our children. And now, 9 months later, if we can track the virus, we're welcoming the break.
So if you're dealing with severe staff shortages in these hospitals, what is the alternative? Then is it just to continue on short-staffed? I mean, does the governor have a point in saying, hey, listen, we don't really have any choice here?
Yeah, in my day job, so to speak, I am a nursing administrator, so I can definitely see that side of it too. You get to the point of what are we going to do? I will tell you that North Dakota got a great deal of Army nurses that came today to our state, so we're very fortunate and thankful for that. So we're getting them trained in so we can utilize those nurses as soon as possible. But I just don't feel that a positive asymptomatic COVID nurse can provide the safe care that our patients need. It's a virus that really takes people out, and our bodies need to rest as well.
What is the toll that's being taken right now on long-term care facilities, on nursing homes, on people's parents and grandparents?
Yeah, it's very difficult. I work in long-term care, and since March, our family members have not got to see their loved ones for more than probably about a 2-month period of time when the numbers in our state decreased a small amount, so we were able to have some visits. And since it spiked back up late summer, early fall, they've not got to see their loved ones in months. And I personally work in a dementia care unit, and our residents change by the day, sometimes by the hour. So some of our residents sadly may not recognize their family members when they do come back to visit. It's been really difficult. It's been very emotional for our staff, as well as the testing process can be very, very draining.
That's really just hard. Are North Dakotans taking this seriously? Are they getting the message now that these numbers keep rising?
Sadly, I don't think so. It's since our governor mandated masks about 10 days ago on the 13th, he did that. We're seeing a lot of pushback still from our community members, from county sheriffs, from other elected officials, members of our legislature, still just aren't taking this seriously. And so as nurses, we spend a lot of our time pouring our hearts out, speaking to the public, educating, and just letting people know how serious this is. And again, that it's not just about COVID-19. With our hospitals in the state that they are and the high capacity, people who have other conditions, diabetes, heart disease, motor vehicle accidents, your children could fall off their bike. They may not have a hospital bed or a nurse to take care of them. We're in a very critical situation, and we just need people to do their part and come together and take it seriously.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.